Erica, it was very cute. Erica and I went to Duluth together for the Minnesota Department of Health, and it was my first business trip ever. And so Erica took a cute picture of me to send to my mom. So Erica and we have a long history together, and I'm grateful that she gave me the opportunity to present today. So I'm going to talk about the blood pressure hubs that we're working on at the American Heart Association. So I'm going to share my screen. And you all can see the slides and not the notes, right? Wonderful. Okay. So I work for the American Heart Association. My role there is as a community impact director, and that's working in community health. I've worked there for about a year and a half. Had previously been at Health Partners, and then before that was at the Department of Health. And I also work with Heather Peterson, who is on this call. So Heather, feel free to jump in at any time if you want to add stuff or, you know, make notes or maybe chime in. Please feel free. So we wanted to talk about, or I proposed this topic for one of the MPHA conferences, and we didn't end up presenting or doing a poster. And so Erica thought this might be a good chance to bring this to the Health Equity Committee. So we want to talk about meeting the community where they are to address hypertension, and that's awareness, screening, and referral programs, or what we call blood pressure hubs. So the American Heart Association is dedicated to achieving our 2024 impact goal, which is strategically developed and based on the latest science and data that every person deserves the opportunity for a full, healthy life. And as champions for health equity, by 2024, the American Heart Association will advance cardiovascular health for all, including identifying and removing barriers to health and healthcare access and quality. So you'll see that the 2024 goal has an even sharper focus on health equity than in the past. And we want to say that health equity in this circumstance, they identified, or they defined it as a state that would be achieved if all people had the just opportunity to be healthy. So a more detailed statement on health equity from the American Heart Association is everyone deserves an optimal and just opportunity to be healthy, giving special attention to the needs of those at greatest risk of poor health, and no one is disadvantaged from achieving their potential because of social position or any other socially defined circumstance. So this is a little graphic just to kind of show the different areas that the APHA works in. It's the goal to always do all of this work with equity at the core. And so the outer ring of the circle shows the American Heart Association's work in communities that drives equity. We reduce the risk for women, addressing community needs, work to end e-cigarette and tobacco use, provide tools and programs, empowering people to lower their blood pressure, improve nutrition security, and build mental well-being. So we're going to dive in a little bit more detail about how we're working in those areas in a little bit. But you'll see at the center of the circle, you'll see this work applies to each of our impact areas. And we've strategically chosen each of these impact areas based on science and expertise, showing that these are the most effective ways to equitably save and improve lives. And so the foundation of this graphic is what the work literally looks like both nationally and in our community. So this might be research, researching to find solutions that will help people enjoy full, healthy lives. We're a leading nonprofit in stroke research and heart disease. It applies to like hospitals and health systems doing quality improvement work with science-based treatment and prevention. There's also work at the HEA being done by volunteer advocates in the policy space as well. And then our emergency cardiovascular care is one of the big big pushes in the next couple of years. You're going to hear a lot from the American Heart Association about CPR and about having a cardiac emergency response plan. Sorry, my dog has been below me and almost knocked everything off my desk just now. So let's get into blood pressure. So nearly half of the US adults are affected by high blood pressure. Half of them, almost half of them do not have it under control. Almost only 1 in 4 have their blood pressure under control. Many are not even aware of the fact that they have high blood pressure, which is really dangerous because, you know, as we all know, uncontrolled high blood pressure damages the arteries, heart, and other organs. It can cause heart attack and stroke, and it's a symptomless condition, but for the most part, which has led to it being called the silent killer. At age 50, people with high blood pressure have a life expectancy 5 years shorter than those without. So you can see how important blood pressure is to so many different outcomes, health outcomes. However, research has shown that Black and Hispanic people are twice as likely to develop high blood pressure. And we know also that there's a COVID-19 component of this, where there's disproportionate negative outcomes for those infected with COVID-19 with hypertension. So we are, one of our community initiatives are these awareness, screening, and referral programs, or what we're calling community blood pressure hubs. So we want to put these out into the community to create opportunities for folks to become aware of their high blood pressure, to be able to monitor it themselves regularly at a regular pace. They can write it down, they can keep it in their wallet, they can show it to their kids, they can show it to their grandkids, they can show it to their doctor. And we want to offer an opportunity as well for those to be a referral hub. So folks to find medical care as well by stopping into that BP hub. Not find medical care at the BP hub, but have a referral list available for folks to find medical care if they need to. So at these BP hubs, there's some key components. We want there to be regular and easy access. So these are locations that are outside of a clinic or outside of a drugstore. You know, some folks don't have access to those, or maybe they don't feel comfortable. You know, sometimes you don't feel comfortable at the clinic. Maybe you're nervous, maybe you have some medical trauma in your past, and getting your blood pressure taken there is not as comfortable of a space. Or maybe it's far away, or you just don't have a clinic or somewhere that's a regular place that you go to. So we want to have these blood pressure hubs in places that are offering regular and easy access. So we're talking about community colleges, we're talking about grocery stores, we're talking about libraries, we're talking about community centers, places like that. And this is a place where there are automated blood pressure cuffs for folks to be able to take their own blood pressure. So it's not somewhere that requires nursing staff or you know, a technical expert. These are places where there's easy automated blood pressure cuffs available for folks to monitor their own blood pressure regularly. And we offer with those sites resources. There's a booklet available, there's handouts that you can print out around like, what is blood pressure? What is high blood pressure? Because that's often, I think, one of the biggest barriers to understanding your blood pressure is like you get your blood pressure and you're like, okay, what does that mean? The HA changed it and I don't know what's high and I don't know what's low. I don't know if that's even good. Now what? So we want to have resources available to talk about what is high, what's elevated, what's critically high. And then you want to have, there's resources there available talking about how you can lower your blood pressure and why it's important. Like, what are the consequences of high blood pressure as well? And then at these sites, we also have a list of clinics or healthcare centers that they can go to, the folks that visit these blood pressure hubs, if they have a high reading. So if there's a reading that's high or maybe too low, or maybe they don't understand, they don't know if it's good or bad, they just want to talk to a healthcare provider about it. Then there's a list provided of free and low cost clinics in the area that you can go to that we've had a conversation with. We've created a relationship at the AHA with those clinics, so they know that these patients are being referred to them. So somebody could call up St. Mary's Clinic and say, hey, I measured my blood pressure at the library and it's high. Can I come in and see you? And they'll know what that means. They'll know that this is a blood pressure hub and they're being referred to them from the blood pressure hub. So those are the key elements. There's lots of resources available, a plethora of resources. And so I want to get into some like real life examples of these blood pressure hubs. So for example, in 2019, the Heart Association looked at the data and they set aside some funds to place blood pressure kiosks out in the community. So kiosks are those things you see at the drugstore or sometimes at the clinic or grocery store where you sit down and you stick your arm in the thing and there's a screen and it tells you what your blood pressure is. So those blood pressure kiosks were funded and those are leased. So you rent them each year at that location. And so the AHA looked at the data and you can see here the death rates in Minnesota. This is from 2019 for heart disease and stroke. So for every 100,000 people, you can see the disparity in the rates, the death rates between the white population, Hmong, and then the American Indian, Native American population, which the American Indian and Native American population had a 53% higher death rate from heart disease and stroke than the white population in Minnesota. In Hmong, it was 40% higher than the white population in Minnesota, which is just awful and staggering. And so the AHA worked, I wasn't working with the AHA at the time, I was actually working with the Heart Association. But they worked with several community partners and found places where folks in those communities could access blood pressure kiosks. So 2 of them were placed. One was at Hmong Village in St. Paul, here on the right here. And then the other one was at the Division of Indian Work. So in 2019, we worked with those communities to place blood pressure kiosks there for 3 years. And this is creating access to measuring blood pressure in a trusted place, potentially from peers even. It was meeting the community where they are to address hypertension. And AHA there was so popular at the Hmong Village. It was so popular in the first quarter of the kiosk being there, over 1,500 community pressures came in and used the kiosk to measure their blood pressure. And so it was so popular that the AHA even paid an additional year for a 4th year of that kiosk to be placed there. They also worked with community partners to have nurse volunteers there at the Hmong Village location on Saturdays, and then partnered with some other folks. I know Regions Hospital was involved in translating materials into Hmong and offering hands-on CPR training as well. Any questions so far about up to this point?
Claire,
Yeah.
do you have the statistics for the Black community?
No, not on me right now, but I can find it.
Okay, I would be interested in,
Yeah.
or at least knowing where to find that. Because yeah, I'm wondering where that falls. I'm in the Black community. It's usually, right up there with the American indigenous
Really.
community.
We're doing right now, and Heather can attest to the work that we're pouring into this right now. We're doing a community health assessment to create our strategic plan. And I know we did pull those numbers. And we did identify the Black community as a community that we want to focus on in the next upcoming 3 years as well, because like you said, the rates were disproportionately higher, but I just don't have the numbers on me, but we can find them for sure.
Thank you.
Do you want to send me a private message here over Zoom with your email and I
Yep.
can send it to you? Okay, perfect.
Yes, thank you.
Yeah, of course. That's a great question.
So Claire, there's also a couple comments in the chat.
Okay.
The one's from Laura Church. She said, many people with hypertension don't realize they have it. They've been told, but they really don't understand what it means or that it is something they need to monitor and can have long-term consequences. So Laura, I don't know if you want to talk about that more, or you just want Claire to respond?
Such a good point. And my question is, what do you think where do you think that hesitancy to respond, if you're told you have high blood pressure, like, my question is like, where can we help influence people to understand like how important it is to respond, or what are the barriers to responding to that high blood pressure? I think sometimes it could be just not understanding how, like you said, not understanding how crucial it is. Sometimes if you don't have symptoms of something, like it's hard to get yourself to the doctor sometimes to get that work done. But I'm curious if folks have other thoughts on that as well. And I can't see the chat, unfortunately, I don't think.
Hi, I'm Christine. I'm from the city of Brooklyn Park. We also do Health on the Go, which is mobile
Hi.
health. Hi. I'm sorry my camera's not working. I couldn't make it to IT today, but
No worries.
yeah, with me personally, I'm black. I'm a black American, and I also have hypertension. And I think when I first found out I had a hypertension years ago, I didn't really take it seriously because I thought, okay, I'll just change my eating habits. Oh, you say I have blood pressure. Okay. And the doctor's like, no, you should come back and you need to, and I'm like, I'll just change my eating habits. I'll be fine. I'm super mom and I'm working 2 jobs. I'm not thinking much of it. And me personally, like if you're of color, you also you don't like going to doctors because of the experiences because there's not a lot of physicians. I didn't have, when the places I were going, there weren't physicians that looked like me. And so I didn't really, feel comfortable going to doctors in the first place. So I only went to the doctor unless I really had to. Now I'm in public health, but because of my traumatic experiences, I didn't want to, so I didn't really start taking it seriously till I went to a doctor where I really was comfortable. And my blood pressure wasn't going down, and then I started getting the symptoms, the headaches and the other stuff. So then that's when I started like, you know what, I have kids, I have to get this together, and now I'm on medication and I check my blood pressure. But I think that's part of it too, especially when you're dealing with people in the community who are of color, and the people that they're talking to, the physicians they're going to, don't look like them. And you're getting told like, hey, when you go to the doctor, you're not going to get treated fair like somebody would if they were white. So I think that's part of it too. And I think it's a pride thing too, because we think, oh, we're fine, we can just keep especially when you're in a position, especially with me seeing a mom, I was just so used to dealing with stuff. I'm like, oh, I can deal with that, that's no big thing, so
Right.
So like you said, it's all about people taking it seriously.
I really appreciate that. Thank you so much for saying that. We hear that a lot, that moms are always like the last ones they're taking care of themselves last, right? Because they're taking care of everybody else first, and then they tend to prioritize their own health and care and well-being last, because they're like you said, super moms. And so that's one thing that we've heard a lot that's really important to think about. And then I hear too, and then I see in the chat as well from Heather, as well, that there's sometimes just awful experiences with the healthcare system, which will keep people away, and it can instill more fear and anxiety than you know, trust and relief and believing that this problem is going to get fixed. So that is definitely definitely a really excellent point. And then, you know, like Laura said, sometimes you just don't think it's a pressing issue. And you think like, oh, I'll stop eating bacon or whatever, you know, because like somebody else said, you often don't want to share a lead. You don't want to take medication. That's a lot. That's a lot to like take medication to alter your body. And but so it's really fascinating. I really appreciate this discussion. Yeah, especially with other chronic illnesses. You know, when I was feeling very sick, I went through like a big health thing. I remember it was like such a chore to go to bed every night because I had to take my like cornucopia of medications. And so it's like, God, I don't want to add more on there.
And we have one more question from Gary.
Yes.
And he said, how accurate are the kiosk machines?
Mm-hmm.
I've used them, can't resist when they're just sitting there in the grocery store near the pharmacy. I was told that in-person testing was more accurate.
You know, I don't know the stats. Oh, Renee's on. I don't know the stats for sure about the kiosks. But I know that when there's a person doing it, you can make sure you're putting it in the right place. And let me share my screen again to show you this one graphic. Share. And when we have these blood pressure kiosks, or these hubs, we have these posters up as well. We give them to folks to look at, the folks who are like kind of facilitating, and they can reference these, and people can reference these too. The instructions for measuring your blood pressure: you want your feet on the floor, you want your hands relaxed on like on a table or something. You don't want your feet crossed. You want to uncross your feet. You want to make sure that it's in the right place. You're sitting still. You shouldn't have like smoked or exercised or drink a triple espresso or an espresso martini like right before. That's gonna make it impact the score as well. So I think also when you're in person, you have somebody there who can help remind you of all these ways to make sure that the reading is more accurate. So I think that's one reason potentially why having those in-person readings might be more accurate. And then, if you ever do have a high reading, the guidance is at these blood pressure hubs, wait 15 minutes. If you have a high reading, maybe you're stressed, maybe you're just running errands and, doing a bunch of stuff. So wait 15 minutes, take it again. So that way you make sure it's not just the things in the moment. Exactly, Kathleen. Stress, diet, exercise, all of that are impacted. But yeah, I think it's also important to think about how the blood pressure is monitored, because that can really impact the readings as well. Oh, I love that. To bring your own cuff in so that you can see how your own cuff compares to the doctor readings. That's such a good idea. Just want to make sure I didn't miss anything.
Diana put out a comment about her getting diagnosed at 26 this year.
So young.
Yeah, and it says, I think the myths in diet and lifestyle changes alone won't be enough to improve things as a factor. Mine didn't improve significantly until I was on medication. I was diagnosed with sleep apnea and started CPAP therapy.
Wow.
So
yeah, I also said, I know Sarah said, they always talk about the white coat syndrome of, oh, your blood pressure is higher at the doctor's office. And I said, I think that's why a lot of doctors didn't take it seriously in my early 20s, which is already young enough still, is they just said, oh, you just have anxiety. So it's just normal that it's high because you're probably nervous because you're at the doctor's office, and then nobody ever like followed up on it. So I think there were probably signs for sometimes beforehand that was, and it's not just at the doctor's office as an issue. So that's something, at least that's my personal experience on that of yeah, and glad that I know now that I do have it and I'm able to manage it and everything.
Wow, Diane, good for you for making sure that you got that followed up on. And also good on you for getting that CPAP machine too. That's something people really resist and can have a real impact on your heart health as well. So well done. I mean, like,
I think that's, I will say I give credit here to actually finding a doctor that was like, this is weird that these things are, that you feel the way that you do, wasn't me. I mean, I was like, oh, I'm in grad school. Everyone I know is tired. Everyone I know, so I didn't realize until I did get lucky. Unfortunately, I got lucky to have a doctor that put some puzzle pieces together and helped get a lot of those things worked out. But I have a lot of privilege already in that I'm able to communicate in my, the language that I speak, and like all these other things that like it might have not made it possible for a lot of other people to have that option. So yeah.
Wow, that's great. Somebody took your health seriously. That's always what makes the difference, isn't it? I love it.
So Claire, what happens if somebody comes to the kiosk and they have high blood pressure?
So if someone comes to kiosk with high blood pressure, the recommendation is to wait, give it 15 minutes, recheck. And, we have that list of referral clinics. Am I still sharing? Yes. So we have that list of referral clinics that they can go see. And, what we say is like, feel free to go get this checked out, but you might also come back in, tomorrow and the next day, see if you can get like 3 high readings in a row. And then it's really, really important to get that high blood pressure checked out. But I want to show you something on, where is it? And where's this graphic here? But, if somebody comes in with this hypertensive crisis, higher than 180 or higher than 120, that is a call an ambulance situation, because that's a really scary situation that somebody could have a stroke right at that moment. And so we've had a couple instances where it was at a blood pressure hub up in Fridley, at one of the blood pressure hubs up there. And they, two separate people, someone came in and had a hypertensive crisis and went to the hospital, and they said, you probably just saved your life because your blood pressure was so dangerously high. So it's really important that this is the biggest and the most prominent graphic that we have, those blood pressure hubs, because it's probably the most important one. So I want to just talk a little bit about what we did after those kiosks were placed, because they're great. They were such a wonderful resource for the communities, but those kiosks are not as sustainable. They're not as long-term of a solution because they're leased. So what we did is we went and tried to establish that same idea throughout the Twin Cities, but instead of a blood pressure kiosk, it was a more sustainable solution. So those blood pressure hubs, instead of a kiosk, they're 2 or 3 or so automated blood pressure cuffs those ones that, you know, you wrap it around and then you just push a button and it does everything for you and it shows you the numbers right after. It's automated blood pressure cuffs, and then the same resources and same referral clinics as well. And so this is a map that my wonderful friend Emily Stiles made at the health department. If you know Emily, she is the map queen and we all bow down to her. And so on this map, these yellow diamonds are our blood pressure hubs as of the beginning of 2014. So you can see that we've placed them around the Twin Cities, and then the blue squares are census tracts showing the highest quartile of the social vulnerability index, which includes, let me look at my notes here. So socioeconomic status, household characteristics, racial and ethnic minority status, housing type, and transportation. So we try to place these blood pressure hubs. We didn't look at this map first. It just is a really good representation of how we've tried to work with organizations to place these blood pressure hubs in places where they will hopefully make the greatest health equity impact. And so it has all the same components. There's regular, easy access, education and awareness. You're monitoring your own blood pressure. You can do it as many times as it's available. And then there's that referral to a care site if needed. Let me just see if there's any questions. Oh, well done, Sarah. Getting that blood pressure cuff. And also, if you have certain conditions, I know like diabetes is one, high blood pressure is one. There's other conditions that will often qualify you. I'm going to let this person in to the room. That will often qualify you to get a free blood pressure cuff from your insurance too. So make sure to check with if you have health insurance, call your health insurance and see if you're eligible to receive a free blood pressure cuff, because then you don't have to buy one. You can get that for free from your insurance. So we've got some new locations too. We're working with a bunch of new sites in the Twin Cities to place more blood pressure cuffs out there. And we've done a really bang up job of working with libraries this year. So you'll see a lot of libraries on the list, but we're placing blood pressure hubs with Keystone Community Services, Washington County Libraries, the St. Croix County Libraries, which is just over the border into Wisconsin, the Somali Medical Association of America, International Oromo Health Professionals Association, Henderson Library, East Central Library, Scott County Libraries as well, and then Minders Library in Pipestone, Minnesota. So even though our purview, me and Heather, our personal purview for work is the metro area, sometimes we get to branch out and do some stuff in the outstate communities as well. So in these libraries, what we try to do with each library is we try to have a stationary blood pressure cuff available, whether it's something like this, which is really cool. It's like the hot new cool trend in the blood pressure world. So you heard it here first. It's these tabletop blood pressure monitors. So you stick your arm in there, it measures your blood pressure, it even prints it out. But it's not leased. It is bought by AHA and then gifted to this organization, and then they own it outright. So it's much more sustainable than those big kiosks. And there's of course so much more pricey than these like automated blood pressure cuffs. But, sometimes we get lucky and we get funding to do something cool. And so we've been investing in a few of those for communities. And so you'll have at the library something stationary that you can go and use anytime. And then you'll also have these blood pressure cuff kits. So you can check it out from the library just like you would anything else. So that includes a blood pressure cuff and that those educational materials and the referral clinics as well. Any questions about these upcoming ones?
Claire, I'm looking on, I think, the Minnesota American Health, yeah,
Heart?
American Heart, thank you.
Yeah.
Website. I don't see where there's a list of locations.
I don't think we have one. I think you've identified, or I think that we've identified that, and then you like re-identified that as something that we should do. I don't think we have that
Okay.
listed anywhere, but I
Okay.
think we should. Yeah.
I don't see there's a list in Ramsey County at all, too.
Ramsey County.
Yeah.
Yeah, this is something that we're just doing at the Heart Association, and so what we should do is put a list together of these blood pressure rubs and put it on our list. Are you saying you don't see anything here in Ramsey County?
Yeah. Is there?
Oh,
Yep.
I see. Well, Keystone's in Ramsey County. They have a couple locations in Ramsey County. They'll have they'll have one at their West 7th. They're building on West 7th. And then I think they're planning to put the other blood pressure hub in their food distribution center.
Okay.
Yes. Yeah. And then you can see, where is it?
I'm
You can-
just using a Walmart or Walgreens.
Okay. That's fine. That's fine. These, and you can see here that we've identified these areas that we want to do more. And so we definitely want to try and identify more in this like St. Paul area as well, to see if we can partner with more groups in St. Paul. There's one here. Let me see if I'll pull it up and I'll find that location for you.
Okay. I have a question. How come the reading is so different from I have a personal one that I bought from Walgreens, and it's so different than the Walmart. When I did my reading at the clinic, it's pretty lower too, so I'm confused. Which is accurate?
You want to make sure to buy, exactly. You want to make sure to buy blood pressure cuffs that are on the American Heart Association valid device list. So I will pull up that website and I'll put it in the chat. But sometimes the ones you get at like the drugstore or Walmart aren't on the list, and it's because they're not validated. So so Heather beat me to it. Yeah, so you want to make sure it's I sent it directly. You want to make sure that it's on that list. And then, for all the reasons that we talked about before, if you're using a kiosk, there's nobody there to remind you to uncross your legs or put your feet on the floor or relax your arms or don't hold your breath. You know what I mean? Like sometimes it's nice when there's somebody there to help walk you through that process. They can help make sure you're measuring it accurately. So I'll pull up this graphic again to measure accurately. Like there's ways that you can help and make the reading more accurate, and then also calibration of the instrument too. And somebody said, take your cuff to your clinic and have it calibrated. So you can do that just so that it's more accurate. That's a really good suggestion.
So Claire, you had a hand up. I think Christina, did you have a question?
Yeah, I was just wondering, because I know there's a lot of library locations.
Yes.
And like where I work at, there's a library right next to City Hall. I was wondering how were libraries able to get a blood pressure kiosk? How does that work? What's the process?
Yeah, we reached out to libraries. We reached out to Ramsey and sorry, was somebody talking? We reached out to a bunch of libraries in the metro, and it was who was interested and willing to work with us to put this in place.
And but if somebody like wanted to get something like the rec center or something, would they be able to reach out to you guys?
Yeah, absolutely. 100%.
Okay.
I'll put my emails at the end of this, but I'm going to put it in the chat too right now, because we're always looking for more partners in this.
Okay.
Yeah.
Thank you.
Absolutely. I love all the questions and the comments and the interaction. It's so lovely to hear from you guys. And then I pulled up my map of the blood pressure hubs to look at. So here's my interactive map here. So I can tell you this one in St. Paul is the Cultural Wellness Center. So if you're looking for one in Ramsey County, you can check out the Cultural Wellness Center or Neighborhood House, are the two that are already there. So we've got these blood pressure hubs set up. We've got these new locations that we want to that we're gonna get put out there into the world by the end of or by like 2025, middle of 2025. And then we also have programs for clinics as well. So there's this program called Target Blood Pressure that it's a partnership between the American Medical Association and the American Heart Association. And it's a quality improvement program for clinics to improve their blood pressure control rates. And it's using these evidence-based activities. And under each of these like evidence-based activity pillars, we call them, there's different activities that clinics can do to improve their blood pressure control rates. And so we have mini grants for federally qualified health centers, lookalikes, and community clinics to take part in. And what that mini grant includes is doing participating in Target Blood Pressure, participating in a similar program called Target Type 2 Diabetes, and then completing one of these evidence-based actions. And it's all like that, you know, we're there to offer technical assistance all along the way. So if you're interested, if you work for a community clinic, please reach out because we have this mini grant that will be available soon. And there's no cost to the site to do a BP hub. It's free. They just have to have someone available who can offer it to the community, you know, once a week or something like that. And then we also have some other initiatives that we have going on. So we do a lot of blood pressure stuff, but we also have work in nutrition security. We are working on programs to screen for nutrition security and refer out to food resources, and that's both at the clinical level and in community sites. And then we're working with food distribution centers to sometimes we can offer, like I said, sometimes we get some magical funding and we can offer to help increase capacity to provide fresh or frozen produce. And I like any excuse to include this picture of my friend Ngozi. She works with an organization called Haven International, and their fridge broke and they didn't have the funds to purchase a new fridge. And they reached out to their ship coordinator at Ramsey, and she reached out to me, and we just happened to have it in the budget, and we were like, absolutely. So I got to work with Ngozi to get them a new commercial grade refrigerator. And I think this is like my favorite picture of her ever. So that was like such a fun project for me. And we also work in the tobacco and e-cigarette use, trying to end those, working in similar screen and refer projects. And then there's that big push for cardiac emergency readiness. So that might look like an organization, say, so one organization we're working in this area is with Sane Foundation in St. Paul, and we're working with them to do these cardiac emergency response plans. So making sure they have AEDs in place, making sure they have folks in place who can do CPR, and then making sure that they have a plan and a team in place and everybody knows what the plan is, everybody knows their role. If there were to be a cardiac emergency, then they could put that plan into action. That team would jump into action. They would know who's calling 911, who's getting the AED, who's starting compressions. Because the research shows that you can have an AED and you can have CPR and you can have all of those things in place, and you're still not going to have the best chance of a best outcome if you don't have a plan for how those are going to get used. Yeah, SANA Foundation. They are great. They are a great partner. And then there's also, you know, we're thinking about other more like community interventions to eliminate disparities in calling 911 or eliminate disparities in bystander CPR. You know, we want to make sure that CPR classes are available in Spanish if people want to take them and they speak Spanish, things like that. And I think that is my last slide. So I would love to answer any other questions, or Heather, if you want to jump on to answer any other questions folks might have. I really appreciate your time and all of your thoughtful comments and questions, and would love to answer any more that you have.
Thanks, Claire. If people have questions, you can jump in or raise your hand to ask.
I'll jump in. This is Charmin. This has been great information. And I work with the Black community and working on a couple of initiatives. One is around prediabetes with Black women. And the other is we just got funding for a heart health initiative through Hennepin County.
Wow.
And so, yeah, so I would love to connect with you offline.
Yes.
Yeah, so I'm just very excited because I do have some ideas. And so my question is, you mentioned the grants. So is it a small grant per site?
Yes, and they're just for clinics like FQHCs, those federally qualified health center, or lookalikes or community clinics. So it's just right now a mini grant available for clinics.
Oh, for clinics.
Yeah.
Okay. Okay. So then if you don't say need a grant and you have other means to pay for it, could a community center or somewhere qualify?
To do like a blood pressure
To have
hub?
yes, to have a hub.
Yeah, absolutely. You know, our funds, we don't like everywhere in public health, we don't like, nobody has all the money is what as my career goes on in public health, I'm like, dang, nobody has all the money, do they? But so we don't have like a ton of funds, but we're always looking for partners to do blood pressure hubs. And if we can't make it happen this fiscal year, we'll set it up and we'll try to make it happen the next fiscal year. Or we can just try and find some room in the budget for that. And, you know, those are really, budget wise, not a crazy, insane, like hard lift, because it's just like automated blood pressure cuffs, some material, you know, some, what's the word? Educational materials, and then those referrals. And so it's a really easy lift to get those blood pressure cuffs off the ground, or blood pressure hubs off the ground, as long as you can have the space and the time available for them.
So Claire, can you say a little bit more about the time? Is it a staff person that has to be there when the hub's operating?
So if it's a library and you have a blood pressure cuff, you know, available maybe like behind the counter, then somebody just like, maybe it's like the librarian or the person behind the counter has to be able to like hand it out and has to be on hand to answer questions. You know, what we've done in the past too is we worked with a community college to do a blood pressure hub, and it was facilitated by their nursing students who also got credits for it as well. So they said like every day, every week, every like Wednesday and Friday from 1 to 2, these blood pressure monitors will be available at the cafeteria or something like that. The requirement, I think, is like once a week they have to be available at the site. And they there's also been, what are some other good examples? Like at churches too, there's a church up in Fridley that runs a blood pressure hub, and they have volunteers that come in. They have like a food shelf and a coat closet that they run like during the weekends, and they have volunteers come in and just facilitate the blood pressure hub as well. And all you have to do as like the person facilitating is be there in case somebody has questions about the cuff, or if they have questions about blood pressure, you can walk them through those educational materials. And we do trainings for those folks as well. So they don't have to feel like they have to be experts in it already. We will train you to do that. Portable enough to have at community health fairs. Yes, absolutely. These cuffs, most of the time, they are those. Let's see if I included let me see if I included a picture of the cuffs. Yes. So these, most of the time, a community blood pressure hub will basically be these elements here of automated blood pressure cuff or 2, and then some educational materials. So it is pretty portable, pretty easy to move around.
Quick question, what's the difference between this one and then the previous photo when you were at it was like sponsored by CVS at the
This one?
nope. Keep on
Oh,
going.
the kiosk?
Oh, it was the kiosk. So that's a
Yeah.
kiosk.
This one, is that what
Yeah.
you're thinking of?
Yeah.
Yeah, so this kiosk is what you would see at like the grocery store or the drugstore, and it's like a whole big deal, and you like sit and you stick your arm in it, and then there's that big screen. And these, we don't own those to give away. Those you lease from the company that owns them.
Got it.
Yeah.
So are you evaluating the results of the hubs?
Good question, Erica. Erica is asking this question because I was her evaluator, and I always made her give me her evaluation data at the health department. We do want to hear back from the partners or the collaborators that we work with to hear, are folks engaging with these blood pressure cuffs? How many people do you think? And then what we really want to know too is if there's any stories too, like did somebody realize they had high blood pressure and it made a difference in their life? So it's not that like really rigorous like logic model table evaluation that you might see for a grant, but we are wanting to hear back from the partners and make sure, is it still like, is it of value? Are there any barriers? Are people using, how many people are using it? It's like evaluation light, I would say.
Yeah.
I think that's one interesting thing about the Heart Association is all of these things that we're working on are all evidence-based. And so all of these things that we're working on are all evidence-based. So we know that if we place a hub in a community, it's gonna help improve the blood pressure, right? And that like they're all science-backed. So then the evaluation piece is more about engagement and is it being used, the dose, all of that. Are there barriers?
Yeah, that's what I was wondering, if you're tracking how many people use them too. So I think
As much as we can. We also just don't want it to be a burden on the site.
Yeah.
you know, like I think there used to be much more robust evaluation around use, but then it also became a barrier to sites, you know, taking on this blood pressure hub because it became a burden.
That makes sense. Are there more questions for Claire?
This is Kate O'Connell, and you may have answered this while I was excitedly looking up things for the Santa Foundation, and you know,
Oh,
I go off on tangents, and just really appreciate the great information. Gary from Blue Cross Blue Shield, I don't know if you got to his question.
Yes.
Did you answer that one?
Yeah, but let me show you again, because it's really easy. It's the blood pressure hubs.
Oh, okay.
There's not much to them unless you want to invest in something like this, which is, you know, less portable, you know, a lot
Okay.
less portable. You know, these blood pressure hubs are really an easy lift. It's a couple of automated blood pressure cuffs, educational materials,
Oh.
and referrals to those clinics that we've had relationships with, that we've talked
Okay.
to and are like open to these referrals. It's just finding at that space, do you have somewhere to host it? And do you have somebody who can be there if folks have questions about it?
Okay, thank you so much.
Yeah, of course. Well, I'll put my email one more time up on the screen. Please reach out. It was so wonderful.
This is Kate again. I guess I do have one more question.
Yes.
Is there any, are there any sites that are like in schools? Just thinking about maybe for family night, or, you know, that's maybe a bit of a stretch, but I mean, that would be a, you know, for the mobile site, if it's something that could go to different schools, different sites, so that there can be more engagement with families.
That's a wonderful idea. You know, I think one of the limitations to these cuffs is that they are usually adult size cuffs, but I don't know, you know, this is an answer that I don't know the answer to that, but I'm sure there are pediatric cuffs out there that are on the validated device list that could be included in the BP hub. But I think that's a really wonderful idea to
Well,
look into.
And it could even be for the parents, for the family members
Absolutely.
too.
Yeah, because they're gonna be there anyway, you know, they might as well get their blood pressure looked at.
Thank you.
Yes, and Gary, these automated cuffs are portable. They're battery operated. Yep. Heather, did I miss anything?
Claire, I think you did a great job, and I really appreciate everyone's enthusiasm and interest and great questions and suggestions for more places to go for collaborations. And this has just been a really great conversation. So thank you, everyone.
Thank you, Claire.
Thank you all so much.
Thank you, Claire, for again for presenting, and I appreciate your information. And Sarah, I think you did the recording. Do we have the recording?
Yeah, but I'll stop it right now.
Uh,
And Erica,